Welcome to the Skinny Podcast, where we talk all things dermatology. I'm Carol Nicotero Ward.
And I'm Terry Rudd.
Let's start with a quick reminder. Our monthly podcast is available on iTunes for free. Just search for Skin and Allergy News. We hope you subscribe.
Here's what we have in store for you this month. We'll bring you the latest news from the American Academy of Dermatology's summer meeting in New York. Our biopsy segment will explore how to be an advocate for tougher tanning laws. And Dr. Alan Rockoff dissects the media's coverage of medicine. But first, the news from AAD.
It looks like polymerase chain reaction, or PCR, is more sensitive than just cultures when it comes to diagnosing mixed fungal nail infections. Canadian dermatologist Dr. Aditya Gupta says that the difference between the two methods could explain why some infections persist despite therapy. Unlike cultures, PCR can detect multiple fungi in the same sample. Dr. Gupta says that he uses PCR routinely, and he predicts a wider use of it in the near future. But cost may be an obstacle.
The new guidelines for diagnosing and treating urticaria are on their way to getting published. Dermatologists involved in the drafting process say that the guidelines are straightforward and simple. They define urticaria and its characteristics, the subclassifications, diagnosis, and treatment. For instance, taking a careful history is all that's recommended for patients with acute urticaria. Even in patients with chronic cases, the guidelines recommend only limited initial diagnostic testing, but they do suggest more extensive tests in patients with persistent and significant disease.
A national melanoma screening program in Germany is showing that widespread screening can be complicated. New York dermatologist Dr. Alan Halpern says that based on the German experience, population-based screening is bound to result in overdiagnosis. Those patients could be harmed by the treatment or stress out over the diagnosis. So far, 13 million Germans have been screened for melanoma. Dr. Halpern says that more data may show if population-based screening makes sense.
This could be the year that Congress finally eliminates the Medicare Sustainable Growth Rate, or SGR, formula. A House committee unanimously approved a bill that would scrap the unpopular formula and replace it with a 0.5% pay raise for doctors for the next 5 years. Fee-for-service would continue, but the bill also offers incentives for new care delivery models. The full House could vote this fall. Meanwhile, senators are also at work on their own SGR repeal plan.
It's now time for the biopsy. Our reporter, Lorinda Bullock, spoke with the University of North Carolina's Dr. Craig Burkhart about indoor tanning laws. Dr. Burkhart is an advocate for stricter tanning laws, and he shares how other dermatologists can get involved.
Thank you so much for joining us today, Dr. Burkhart.
Thank you for having me.
Yes, well, the first question I really want to ask to get this started is, why do you feel dermatologists make the best advocates in this particular area?
Well, dermatologists are the best advocates in this area because we're the ones that know the most about the dangers of indoor tanning and the most about melanoma.
And so how did you get involved with advocating for indoor tanning bed legislation?
Well, I became involved through a clinic. So I did a melanoma clinic for about 3 years, and I noticed that 1/3 of my patients were young women, 25 to 35, who had melanoma due to indoor tanning beds. And actually I had one patient, a 28-year-old girl, with 2 kids, and she came back as a teenager, and she actually died of her melanoma. And the tanning beds played a big role in that, so that's always affected me pretty big to see that family devastation caused by that experience. So I got more involved with our local politics through a variety of methods. So we have our local state dermatology society, and they were extremely helpful. We have our state medical society, who actually had a leadership college, and I used this as part of my training in getting more used to legislators and that sort of thing. And the American Academy of Dermatology also had a leadership college and lots of resources to help me out along the way. So all the medical societies help me out.
Why is it so important to work with lobbyists?
So lobbyists, if you have an experienced lobbyist, they'll have connections within the legislature to help you out. They'll know how to steer bills through the legislature in ways that are favorable to you. And they can also help with your time and following bills. Every part of the process, they have experience in it.
And so I noticed that you also had tips on testifying. Can you tell us a little bit about that?
So some big tips are, number one, have short talking points for your legislatures and just go through those point by point. Mm-hmm. Long, prolonged speeches are not ideal. Most of us have a 10-second memory, so remember that. Another tip would be to get familiar with your talking points. So create talking points, then practice them on legislatures individually, and then when it's time for you to testify or talk to the media, you've been well practiced. Now that your peers will be much more comfortable. Just remember that this is more of a relationship. There's no magic spells. You're not going to tell a legislature one fact or one story and they're going to change their mind about an issue. It's more about gaining trust with them and building that relationship.
And I also wanted to know, do you have any, direct examples of where you feel like through doing this work you've been able to see results?
Definitely. The big benefit to this is every time I go to Congress to advocate for this issue, the news media is there and they interview me, and I'm educating the public. So there's a lot of young women out there, I'm sure, that are not using indoor tanning beds because they were educated by this. And it's one of those things where you don't see the faces of the people like you say, but you've done it. It's kind of a cool thing.
Thank you so much for taking the time out to speak with us.
Thank you so much.
The FDA is currently considering whether to impose greater restrictions on tanning beds by reclassifying them as Class 2 devices. At the local level, several states have passed youth tanning bans, with some that cover kids up to age 14 years and others that go up to age 17. Some cities are getting in on the act too, banning tanning beds for minors and requiring parental consent.
And now, from his office in Brookline, Massachusetts, Dr. Alan Rockoff shares how he deals with some of the dire health warnings in the news.
As I'm sure you've noticed, the media has an insatiable need for medical news. There has to be something new to report on every day, preferably exciting breakthroughs and dire warnings. Of course, there are no big breakthroughs and dire risks to warn about every day, but TV, radio, and websites have to find something to report anyway, and so they do. Yesterday, for instance, my email brought me this headline: Med students who shadow surgeons keener on surgery. Wow, never saw that coming. Even better was a bulletin I got 3 weeks ago. Tall women have higher cancer risks. Since I never read past the headlines anyway, I sprang into action and emailed Eileen, my 6-foot associate. Read the attached, I told her. Start shrinking at once. She shot back that she would get right on it. I had a similar reaction to hers a couple of years ago when another study, widely reported in the media, found a correlation between baldness and heart disease. The day after the study was featured on the 6 o'clock news, my patients were solicitous. "Doesn't that worry you?" they asked, trying not to stare at my scalp. "Not at all," I said. "I got a wig, guaranteed to fool my coronary arteries." This is Dr. Alan Rockoff. I am still follicularly challenged, but at least I'm not a tall woman. Even better, I'm not a surgeon. What a relief.
That's it for us. We'd like to thank our reporter Lorinda Bullock and our producers Nassim Miller and Mary Ellen Schneider. This podcast comes together under the guidance of Skin and Allergy News managing editor Heidi Spleet. I'm Carol Nicotero Ward.
And I'm Terry Rudd. Don't forget to visit our website, skinandallergynews.com. And remember, you can subscribe to this podcast on iTunes for free. We'll be back with more news in September.